Hello and welcome to this episode of The Pure Pod, a podcast brought to you by Pure Sports Medicine. Today we'll be talking about cancer treatment and rehabilitation. To discuss these topics, I'm joined by Dean Sutton, a strength and conditioning coach at Pure Sports Medicine, and Jessica Patel, a physiotherapist. Both are specialists in cancer rehab and regularly support patients who are going through treatment for cancer and those in remission. Thanks so much for joining us today. How are you doing?
Very good.
Yeah, well, thank you.
I think it might help for us to start with a general point about how safe it is for people who are, with cancer and undergoing treatment to exercise, as I think many people might think they have to stop exercising once they've received a diagnosis. Dean, is that something that you see in the people that you help?
Yeah, I think there is a little bit of trepidation, but generally exercise is definitely a positive thing if you're firstly diagnosed with cancer and through the whole process. There's lots of good research out there at the moment to suggest that exercise is the best way forward. What's really interesting is that the government's new plan that they've just spoken about, the 10-year plan, is they're looking to actually put a big emphasis on exercise. So there's a lot of things happening in the background with the government, which is really positive, and they want to reduce the cancer rates by 75% over the next 10 years. So that's really positive.
Are some patients kind of reluctant to undertake exercise during their treatment? Can it be hard to break down their expectations and kind of suggest to them to be active?
Yeah, absolutely. I think when you hear that you've got cancer, it's scary.
Yeah.
And then to be experiencing the treatments that you have. Some people go through surgery, some people have chemo, some people have radiotherapy, some people have a combination or all of those things, or they get put on some medication afterwards as well, which can also change their hormonal makeup and result in body composition changes. And so, all of those treatments that you have lots of different effects and symptoms can come up as a result of those effects of the treatment that you have. And it can be really scary, and there could be lots of reluctance to exercise. But as Dean said, the government is putting a plan together to make it so that people who survive cancer, and there's more and more people surviving, so 1 in 2 people, so almost 50% of patients who are diagnosed with cancer are surviving 10 years or more, which is fantastic. But it means that they're living with more of the side effects and symptoms from having cancer. And exercise has been proven to be really effective. So there's lots of medical research out there.
Yeah, I think the three most important things is one is that quality of life, is making sure you have good quality of life. During the treatment, it's also been shown to reduce fatigue, which is a really positive thing. Cancer fatigue is a lot different from just having a bad day at work and just feeling tired. So it really aids with that fatigue factor, but just from a recovery perspective as well. It will actively increase your recovery. So I think those are the three main things for me for exercise. So generally, absolutely yes, it's a definite positive to start exercising.
And there's lots of medical research out there as well. So a study, a systematic review and a meta-analysis from 2025 showed that actually just exercising can be really beneficial for you when you've got cancer. There was a study done in 2025, I think it was a challenge trial, which looked at a 3-year structured exercise program. And not only was it found to be beneficial in kind of really improving the quality of life and symptoms of patients with colon cancer, but it actually showed increased rates of survival as well for longer term survivors of colon cancer. And also there are guidelines out there which, are adopted internationally, which show that exercise can be really helpful in managing lots of symptoms, as Dean mentioned, fatigue, but improving quality of life, physical health, anxiety and depression, as well as other symptoms such as bone health and lymphedema as well.
I think what's a nice one on that study as well is they looked at people after they'd been given the all clear for cancer, and those that were regularly exercising, 80% reduction in actually getting cancer again. So
wow.
It's a huge, quite powerful thing that do exercise once you're once you have cancer and when you've got to go through the treatment, but afterwards keep going. And we can talk a little bit more about the mechanics of that and just from the physiological side of how just beneficial it is to keep going.
Yeah.
It's also really beneficial, for example, patients who get diagnosed with lung cancer, doing exercise before they even start their treatment can actually help reduce their length of stay in hospital, but also improve or reduce the reduction of complications that they might experience following surgery.
That's really interesting. And I think it's obvious that in most cases there is some benefit to it, but I'm just wondering if there are some instances where you would suggest to somebody not to undertake exercise, or if there are certain points in their treatment where they just need to rest. Is that something that you can talk about, Dean?
Most definitely, yes. I mean, Jess, do you want to start elaborating from the medical side?
Yeah, I mean,
and then we can talk. I'll talk a little bit more about sort of the,
Sure.
Yeah, I mean, exercise isn't a one-size-fits-all thing.
Of course.
And I think it depends on the patient's symptoms, but also the treatments that they're experiencing and going through at the same time. So there might be a need to at times pause some of the exercises that we do. For example, if someone hasn't had chemotherapy or they've got an active infection or they've got a fever, we wouldn't look to exercise on those days. We would also look to see, like if there are other, like DOMS, for example, like that delayed onset muscle soreness, or if there was any nausea or vomiting or anything like that, we would want to know a little bit more. So everything needs to be adjusted to and bespoke to that patient, so that we are looking at that patient and we're not just applying a generic, here you go, here's your exercise program. So it has to be more specific, but there can be times when we need to kind of modify and pause. Sometimes we can progress.
Yeah, and just from things like low bone density. So if you've got somebody that is that has got low bone density, yes, absolutely, exercise is good to increase that bone density. But you have to be careful about how you do it and the way you do it. So no real high intensity work. Nothing that's too bouncy that potentially could hinder or hurt the patient. Lymphedema as well is one where we have to be very careful around not doing any high intensity exercises, making sure that that there's no isometric exercises, so lots of holding breath and making sure that we don't put a lot of stress through there. Working with compression pants, compression things, and more sort of lightweight, lighter exercise from that lymphedema point of view. But generally, yeah, there are some real markers that come through. People with sort of going through chemo as well, like exercising immediately afterwards. It's heart rate. Heart rate can go all over the place. So you have to be very, very careful not to exercise post your chemo.
Mm-hmm.
And I think maybe, some people who have colon cancer, they might have like a bag, a colon bag. And so, we'd look to make sure that we're providing guidance and advice on that. We're modifying exercises so they can still benefit from exercise without actually making them feel really self-conscious or kind of increasing the risk. People can still exercise with lines in as well. You just have to work around it based on the patient that you've got and how they feel. Yeah,
I'm sure that there are a lot of people who feel very self-conscious if they've got something like a bag, right? Then that's something you have to work through as a...
Absolutely. And, like there would be advice, for example, when they've got a stoma or anything like that, you would say, okay, well, let's empty the bag out prior to exercising. We'd be careful of not holding your breath. We're using breath a little bit more. We are being mindful of the exercises that we're doing, so we're not going to go into like a full-on plank, to really kind of strain that area. But also, we know that those patients are likely to become a little bit more dehydrated. So when you're drinking water, put an electrolyte tablet in there, because you want to replenish and replace the salts that they're losing, not dilute it with just using water. So there's a little bit more to kind of think about when you're seeing cancer patients from an exercise perspective.
And Dean, I'm just wondering if there's a specific type of exercise that can be particularly beneficial. Obviously, we've said that it depends on the needs of the patient, but I'm just thinking like loss of muscle mass could be like a real issue here, right?
Absolutely, yes. Yes, so resistance training is the ideal scenario for muscle mass, bone density. Aerobic training as well, cardiorespiratory function tends to be depleted. also. And so bit of everything really in my mind. I think good cardiovascular work, strength training, lots of other things around it. Like they recommend 150 minutes a week. We tend to split that down throughout that week. So we'll look at 30 minutes of 3 times a week, 30 minutes aerobic exercise, and then strength training as well. 2 of those around that, but also things like yoga, Pilates, Tai Chi, things like this, just from that, just from the mindfulness point of view, is really good to do. But yeah, I think a combination of everything depends on your fitness. If you're relatively fit before your cancer diagnosis, then obviously your progressions can come a little bit better. But it's basically get everybody moving, and everybody is different. So the intensity and the volume of training is relative to the person that we've got in front of us, basically the patient. So anything and everything from my point of view.
Yeah.
And I think in that, we're not expecting progress to be like linear at certain times. I think when someone's going through active chemotherapy or radiotherapy, we're not expecting them to be better week on week. Exercise is there just to help manage side effects of the treatment from that perspective. And there is some evidence which kind of supports its inclusion for certain things. So, for example, aerobic exercise has stronger evidence in improving anxiety and depression and helping sleep, whereas more resistance training has a little bit has stronger evidence for bone health and lymphedema. But overall, a combination of aerobic and resistance exercises has been been proven to be beneficial with patients who have cancer-related fatigue, physical function deficits, also helping to improve health-related quality of life. And so, to be honest, like Dean said, if you go for the 150 minutes of exercise in a week and you've got a good combination of cardiovascular, which for some people could be walking, and you're adding some strength work in there, you're likely to get a nice overall rounded benefit for lots of different side effects and symptoms that can occur as a result of having cancer or going through treatment.
Yeah.
I think for me the most mind-blowing thing for me is exercise. Your body creates natural killer cells when you exercise. So these natural killer cells will go and attack the tumours. This is the thing for me. This is the real sort of mind-blowing something that I took on board straight away, is that actually with exercise you can decrease the amount of tumour cells that are in the body just by your own not having to have any type of chemotherapy, things like this, but just naturally it will be able to kill the cells off. Doing sort of an array of exercise is the main thing, but there's a lot of good research out there now coming about high intensity exercise, how that actually does help a lot more as well, because it works on what we call the shear stress within the body. So if you think of shear stress, so through arteries, when you exercise, because you're exercising that greater, the blood flow becomes greater. So therefore the shear stress becomes more. So what I mean by that, it's like a hose. It's like if you just turn the hose on just a little bit, and then with the water dripping through, like moderate exercise, that yes, it will absolutely help without a shadow of a doubt. But if you turn it on really, really hard and you get that real gush of water coming through, is exactly the same principle. And having that ability to train that a little bit harder really does help with the blood flow through the body, getting these natural killer cells that will go and attack the tumour cells as well. And you have, like, during cancer, post-cancer, you have circulating tumour cells as well that hang around quite a lot. So there's a lot of research out there to suggest as well that doing high intensity training will flush these out as well. So they'll hang around the body and try and grab hold of something. But regular high intensity exercise, along with melodic exercise as well, certainly does help. And I tend to say to all my patients is 1 minute of high intensity exercise is worth 8 minutes of moderate exercise.
Oh wow!
So there's some really good evidence out there to say, yeah, you can train that a little bit harder. And everybody's relative as well. You can have somebody that's super fit that can be doing different types of high intensity exercise, but you can have somebody that's very sedentary, and that high intensity exercise could be just walking up and down the stairs.
It's very relative to each patient, and it's really beneficial for recurrence as well, because, you know, it's not uncommon to have cancer and then it can reoccur again later. And as I said, because we've got more people surviving for 10 years or more, the risk of cancer coming back again is that little bit higher in those patients. So exercise can be really helpful for prevention, but also it can be curative, as Dean's saying.
I just want to circle back to something that you've both alluded to throughout the course of the conversation so far, which is kind of like the mental health benefits of this as well. So, Dean, I wonder if you see in your patients who come to you and then you start helping them be more active again, that you see an improvement in their mental well-being. Is that the case?
Very much so. Yeah, very much so. I think that's probably one of the most important things, because we like exercising the cancer. We understand that physiological side, and we know that being able to push that a little bit harder and do that a little bit more will help you. But from a day-to-day point of view, it is just so debilitating that one day you'll feel really good, the next day you won't feel very good. And if you've got things like lymphedema, if you've got bags, if you've got different things, the psychology of it, I think, is the hardest thing to do. So to be able to go and exercise and just be in control, a little bit more in control of that, I think is a very powerful thing. And that's where we plan the weeks. You know, when we get the diagnosis, we sit down with the patient and we'll plan the weeks. Some days will be good, some days will be bad. Very much into like yoga, Pilates, a little bit of mindfulness, Tai Chi, things like this. Just helps you, take you away a little bit from that mindfulness point of view. But I think exercise with the anxiety and the depression of cancer is probably the most powerful thing.
It actually utilises like your body's own antidepressant system. So when you exercise, you release endorphins, enkephalins, serotonin. You've got dopamine as a result of actually achieving things. And actually, those are really powerful to help you feel relaxed, to feel good about yourself. And also, it can help with pain. It can help with flexibility. It can just give you that little bit more confidence. And that's really important, because I think that when patients go through a cancer journey, it feels like they're not in charge anymore. Like they are almost a person who's been cut apart, pumped into, poked and prodded. And a lot of patients can tend to lose their identity of who they were pre-having cancer, and then after cancer and their recovery, they're sometimes always kind of labelled as so-and-so had cancer, and actually cancer's like how they're known. So for some people, it can be really empowering to get their life back. And actually, there are people who are still living with long-term cancers, and they're still looking to run marathons, do ultra marathons, triathlons, you know, achieve things. So it's not the end when you get diagnosed with cancer and when you go through treatment. No matter what that prognosis is, there's light at the end of the tunnel, and it's, you know, it's really powerful when patients put their mind to achieving a goal and they achieve it.
Yeah.
I think a lot of the time for me, to a man and woman, that the people that I train, a lot of the time they see the only time I feel normal is when I'm exercising. I feel normal, and post exercise from there, like 3 to 4 hours after the exercise, I just feel wonderful. So that's how powerful it can be, both physically and psychologically as well.
I think it's worth talking at this point as well about how you might work alongside an oncologist, whether that be like a private or a doctor through the NHS, like referring information back to each other. How does that relationship work when you're helping someone?
Yeah, so the oncologist is, you know, the one who helps get the diagnosis, starts a treatment plan, and that patient is on that journey. We as healthcare professionals, like from a physiotherapy perspective, we are the ones looking to kind of help patients manage the side effects of those symptoms, and to gain back some sort of like normality of life and be able to do the things that they do. Because for some people, life is paused. You know, they're not able to exercise like they used to. They can't look after their kids as they used to. They can't go to work like they used to. Social situations can become a little bit more difficult and tricky because of the symptoms that you've got. So it's about making sure that we're working with the oncology team, whether it's privately or via the NHS or using GPs, and where, you know, we are working together to help that patient achieve their goal in a safe, supported manner that's going to help them with their recovery.
Yeah, and that's from my point of view, from an exercise point of view, exactly the same. That we're involved right at the beginning, and we set a plan for the patient, and then from there it's fed to the whole team with my reasons, my rationales. Work closely with the oncology team to make sure that we've got the right level of exercise, the right things are going on with that exercise. Also, monitoring is really important to me. Making sure that, like for instance, with lung cancer, if you've got somebody with lung cancer, so cardiorespiratory issues, to monitor them is really important. So we use what we call an oximeter. So we look at, whilst they're training, we look at the oxygen saturation within the body, and if it drops below normal exercise, people would look at 95 to 100%. So we make sure that when we're doing some cardiovascular training, that's monitored quite closely, and if it drops down to 90, then we look at lowering the intensity of it, and if it drops below that, then we stop completely. So monitoring it is really, really important from my point of view. Same with the strength, with the resistance training, is making sure that we've got a progressive overload in their training. And training is never linear with cancer, so you have to have your fallback plan. So yeah, we've got a complete exercise plan in, but some days if you're feeling not good, then we look at alternative plans. So it could be just going for a walk, or just doing a bit of mindfulness, really.
Mm-hmm.
And also, like, when you're exercising with a patient who's actively undergoing treatment, if there's something that you think doesn't feel right, we'd be in contact with the oncology team to say, look, we exercised with this patient, they reported this, or we're thinking of this, could you please have a look? And so it's an open communication channel, works in both directions. So it's not you see the oncologist and you see the physiotherapist or a S&C coach. Actually, we are one team. It doesn't matter if you're NHS, it doesn't matter if you're private. We're still in communication. We have a duty of care, and we're going to make sure we fulfil that.
Again, I think what's nice about this, the government's 10-year plan as well, is they're making exercise more available. Mm-hmm. Just on a personal note, a friend of mine passed away a few years ago, and he would go to patient groups, and they would sit down and talk about how they feel and how they felt on a weekly scenario. They never spoke about exercise. Exercise was never spoken about. So I think with the government now talking more about exercise, where they're going to have online training plans, I mean, it's not ideal, but at least it's a beginning. And they're looking to have group sessions. So I think it's a real positive start from that point of view.
Yeah. And I'm just thinking, is it a case of sometimes maybe the oncologists or maybe the medical professionals are more, and maybe this is changing with this new government plan, maybe they're a little bit more reticent to suggest that people should be exercising, or is there generally within the whole ecosystem now a commitment to suggesting it to people? Because I'm just thinking sometimes a medical professional's first inkling is to suggest maybe just resting and doing no further harm.
I think research is showing that more and more exercise has benefits, and so you'll find there are oncology teams out there which are more proactive in getting that support. There are NHS trusts out there which are providing cancer rehab services for patients. I think with some of the pressures and the strains that the NHS is under, it's very difficult to ensure that every patient gets lifelong exercise. So this is where that cancer plan that Dean mentioned is coming in to make sure that patients have access to exercise via the app, at every point throughout their recovery, no matter how long ago they had their treatment, but also that they're looking to improve not just only longevity and life expectancy, but to help reduce occurrence. And also, if we have healthier people, we also have less diabetes, less obesity, less blood pressure, less cardiovascular risks as well, because cancer has an effect on all of those things, because it's just knocked your whole body for six, not just a particular body part.
I'd like to look a little bit more specifically at rehab now. So Pure obviously offers a cancer rehab service. How might the two of you work within an MDT to help a patient progress after they've received treatment?
So a patient might come in and they might come and see a physiotherapist first. And it depends, at any point in their care with us, we will recommend physiotherapy or S&C or exercise physiology. We've even got Pilates instructors. They might even need to see soft tissue therapists who have skills or experience in working with patients with lymphedema. I think it depends on that patient's goals. Sometimes we start off in a supported environment with a physiotherapist, and when that patient progresses, they can go on to work with people like Dean if they have achieving higher goals that they want to reach. So they want to be able to perform, and they want to look at marathons and high specific sports activities. That's where someone like Dean or an exercise physiologist can come in handy. So we work together. There's lots of crossover, but we work together. I think it's just seeing what that patient needs and when they need it.
Yeah, and I think from my point of view, just from the exercise side, we set a plan in. We make sure that we've got a plan going. The best thing for me is that I can just turn around and speak to Jess, or speak to a soft tissue therapist, or say, look, let's go and do Pilates. So just refer them on to one of our Pilates teachers. So it's such a nice environment to work with, because you don't have to be jumping through hoops to try and talk to somebody. As I said, cancer and exercise is non-linear from a training point of view. So if we get blips in the road, then I can straight away talk to Jess or talk to whoever I need to talk to straight away. I think from an exercise point of view, what tends to happen is people will come and see me once a week, and then we set a plan around that week, 2 weeks, or depending on the period of if they're going into chemotherapy or into some other sort of therapy, sort of pre or post surgery, then we set the training from there. But I think the great thing is with that MDT is that we're all able to work closely together, and that we can reach out to each other as well.
And also it might be that you see a physiotherapist initially, you go work with an exercise physiologist or a strength and conditioning coach, and then you come back and you have a review. And sometimes it's when you see a physiotherapist or you have that review that you realise how much progress you've made when you go back through certain tests that you did at the beginning. So it can be really hard to see the progress that you're making because you're living with this day in, day out. And yeah, you might notice that some things become easier, some things are not as challenging as they used to be, which is great. But then you come in and you see one of us and we do some of those assessment tests again, and oh wow, you've improved. Like, there's like a 30 to 40% improvement in the few weeks that you've been working with us. So it could be quite nice just to keep people motivated, to have different inputs as well. And, we all work on different things and we all have different interests, and that's fantastic.
That actually brings me on neatly to the next question, which was like how you kind of manage a patient's expectations. Maybe they're a bit frustrated that they feel that they're not progressing as they'd like to. And as we've said, progress isn't linear at the best of times, especially when, you're recovering from something as serious as chemotherapy or radiotherapy. So how do you kind of manage that with your patients?
I think you really just need to have that honest conversation with your patients and ask what it is that their expectations are. And I think, you have to say what, and like Dean says, you look at their journey that they've been through, and it's not that your expectations are unrealistic. It's just maybe we just need to tweak them. How long they take to achieve might be a little bit longer. We might need to put some smaller goals in between, because it's more important to be achieving goals. Smaller ones that you achieve result in that nice dopamine release. You feel good, you feel motivated, you're encouraged to push on a little bit more. Whereas if you have a really big goal, that's much tougher to achieve, it's really easy to become disheartened and become demotivated or unmotivated, sorry. And actually, it then kind of feels like you're not getting anywhere. So I think it's hard to manage those expectations. Every patient is very different, but you have to have that honest conversation and then find out what their ultimate goals are and work towards them one step at a time.
Yeah, and I say to all my patients is expect to step back. You're going to have blips in the road. It's going to be a very strange journey. What's quite funny is that, or not funny, but what I find is that if somebody has got very limited experience within exercise, it's actually quite easy to manage expectations because you can just give some nice, easy, progressive overload, a little bit of exercise. People that have exercised at good levels tend to get very, very frustrated because they've had a journey of where they've been. And that's where I say, expect to step back, because sometimes that's just not going to happen, especially when you're going into treatment. So expectations are very, very, very difficult. But as Jess said, that frank and honest conversation to start off with, and saying to people, look, when we hit that blip in the road, then you need to be honest with us and let's talk. And then your expectations, we can manage from there.
We use things, we've got a tool that we call the progress tracker, which when they come to see a physiotherapist, patients will set themselves some goals, and then we'll be contacting those patients at like 6 weeks, 3 months, 6 months and a year to see how they're getting on. And at times they might still be in the service or within the company having treatment or seeing us for ongoing kind of like rehab if they want to, or they might have kind of achieved their goals, and it's a nice longer term look to see how are you doing. And it's quite nice because I did a research study on that one, and actually patients said that they really like being able to see like the longer term effects of are they still where they wanted to be, and are they still kind of going to where they want to go towards. So that's quite nice as well. So it's not just we're looking at your expectations while you're with us, it's also this is longer term as well.
Okay. And we've spoken about recurrence of cancer as well, and I just wonder if there's any data or any statistics or any of like the findings that you found within your work that prove just how important activity is in mitigating that risk of recurrence.
I mean, I think that challenge trial from 2025 in colon cancer, I can't remember the statistics off the top of my head, but I think it resulted in like a 80% reduction in the recurrence of cancer within, I think, 5 years, and then 90% within 8 years or something like that.
Yeah. 80% reduction.
Yeah, it was really high. So it's really important to keep moving. And it doesn't mean that everyone has to get into a gym. Activity is very subjective and it's very unique to the person and their current baseline level. So even if it just meant you're going for a walk 3 times a week, or you're running up the stairs a couple of times a week, or you're lifting heavier shopping bags, that can be enough for some people versus going to the gym and doing some higher intensity stuff or weight training. It's really relative and subjective to that patient.
Yeah, I totally agree with you. I think it's to be able to carry on in the future is super important, because all the research out there is saying that it decreases those mortality rates. So, but it's just choosing your poison, so to speak. It's about what you like to do, and whether that just be just walking, whether that be run marathons, keep planning because it will always be there in your mind. It will always be there in your mind. So just keep planning of, right, what can I do today to make myself feel a little bit better?
I've just got one question left. Thank you so much for your time today. What would you say to someone who's listening or watching who might have just got the all clear and they're nervous about getting active again? What would be your piece of advice?
I'd say contact a physiotherapist, or if you don't have a direct link to a physiotherapist, go to your GP, make that first appointment. It's the hardest one to do. Come and have a conversation with us. We will listen to your story. We will find out what it is that you want to achieve. We'll sit down with you. We'll make a plan and we'll discuss those goals and we'll start getting you there. You don't have to be experienced in exercise, as Dean has said before. You know, just taking that step, that first step, is the biggest step. And it can be the step that you need to help you get back to where you want to, or to change the course that you're currently on to something else.
I mean, like post-cancer, I think it's a case of you've gone through hell, basically. You've gone through hell. Understand what your body's limitations are, and then just really look at, as I said, something that you feel that you like to enjoy. Just go out and do it. As long as there's exercise based around that. Set yourself some goals are really, really crucial for me. That with, again, everybody post-cancer, I would say, right, what's the next part of the journey? What are we going to do now? So whether that be running a marathon, or whether that be, you know, pushing my daughter around the park run on with the pushchair on a regular Saturday, absolutely fine. But just make a plan and keep planning through.
I think the key thing is, whatever you do, make sure you're having fun.
Yeah.
Because if you enjoy it, you're going to stick to it. And if you enjoy it, you're going to benefit from it. And it's going to have way better effects on you if you're enjoying what you're doing versus you're just doing it because a physio and an S&C coach kind of told you it was good for you.
Yeah, and I think especially with men, talk to somebody. Post-cancer, if you're like with prostate especially, if you're worried about something, reach out and speak to somebody. Men are terrible for not talking. So it's so helpful just to be able to reach out and speak to anybody. And I mean, we do free 15-minute sessions. I'm more than happy to sit down with everybody, you know, chat with somebody, just to give them a little bit of advice to start off with and just to create a plan. So yeah, definitely for men, go and talk to somebody.
Yeah. It's a great place to leave it on. Jess, Dean, thanks so much for your time today.
Thank you.